quick look at the different types of muscle contraction. There are 3 different types of muscle contraction that you need to be aware of: isometric contraction, isotonic contraction, and isokinetic contraction. So let's have a look at the first one, isometric contraction. You can see an example is shown here where the individual is holding a dumbbell and they're holding it out in front of their body. Their muscle is contracting because it's holding up the resistance, so a force is being produced, but there is no change in muscle length. Some practical examples of isometric contraction in terms of a circuit type activity or a resistance type activity: the plank, where they're holding still, so a force is being produced but the muscle's not changing length. And a practical example in a sport is gymnastics, so on the rings, that position is being held still. So there's a contraction you can see, but there is no change in the muscle length. So muscle contraction isotonic, this is the most common form of contraction, and the muscle changes length as it contracts and it causes movement of a body part. So what we're seeing here is we're seeing the bicep and we're seeing a bicep curl. So the movement that's occurring is the dumbbell is being brought closer to the shoulder, so that's flexion at the elbow joint, and what's happening is that muscle is pulling on the bone below the elbow and it's pulling it closer. The tendon attaches the muscle to the bone, and the muscle, you can see the bicep there, is getting shorter as the barbell is being moved up. Flexion's occurring at the elbow and the muscle is changing length. So the practical example is listed there. And the concentric contraction, because we can further divide isotonic into concentric and eccentric contraction. Concentric is the muscle is shortening, so here the biceps shortening, whereas when it's actually being lowered and there's extension occurring at the elbow site, the dumbbell is being moved further away from the shoulder. That's called eccentric. You can see that the muscle is still contracting, but it's actually lengthening at the same time. They're both called isotonic contractions, and it's because they both change length, but one is shortening and one is lengthening. A practical application here. You can see we've got isometric included up the top there, but you can see we've got a lateral side raise, and we're looking at the deltoid, which is that muscle on top of the shoulder there. So when you're undergoing a concentric contraction, the arm is being taken away from the body, and you can see that the muscle, the deltoid there, is shortening. Whereas when it's an eccentric contraction and the arm is being lowered down towards the side, the muscle is lengthening, so that's eccentric contraction. So the muscle contraction that we tend not to hear as much about is isokinetic contraction, and what happens with this particular contraction, it needs to be performed with a special type of machine. The muscle changes length, but the speed is held constant by a particular device. So they use some of these devices at gyms like Curves and those sorts of gym type activities, but they do need to be specialized because they change the resistance as you move. So if you were to see an exam question like this, and there has been one a little while ago, and it showed a picture of the machine there, and you had to determine what sort of contraction was occurring. So isokinetic is a machine-based exercise where the muscle changes length but the speed is held constant. So it's still getting longer, or it's still getting shorter, but the speed is held constant. And that's a practical application that you can see there. So a type of exam question that you might receive, this is just a really simple one with relation to plyometrics, and you can see here that it specifically says eccentric and concentric contraction. So if we're going to take a look at this, question 4, single leg hops are an example of a plyometric exercise, and it's asking you in the takeoff phase which sequence of muscle contraction best describes the contraction utilized by plyometric exercises. So pause it now if you want to have a little bit of a look at the answers. Generally you can wipe away 2 straight away, and in this particular one it's out of C or D. So it's a rapid concentric followed by a forceful eccentric, or a rapid eccentric contraction followed by a forceful concentric contraction, and the answer is C. Remembering that with plyometrics it's a lengthening of the muscle, and then that stores the elastic energy, and then that is used in the forceful concentric contraction. It also trains the stretch reflex. Remember, when you stretch a muscle, it contracts faster, so it's training that there, just like an elastic band. And one more topic that's really relevant to this is the concept of fatigue and muscle contraction. So just wanted to have a little bit of a look at an isometric contraction. In this particular example on the right, you can just think of it as maybe a calf raise, but a calf raise that's being held in that same position. So what happens during an isometric contraction? Remember that the muscle doesn't change length, but what you can see here is that when the muscle contracts initially, it pushes on the vessel. Now what happens when the vessel is pushed on is that the blood flow is occluded, so you get less blood flow to the muscle and you get less blood flow away from the muscle. What this means is that you're going to have a decrease in oxygen delivery because you're not getting the blood flow there, and metabolic removal. What this means, without the oxygen being delivered to the muscle, is that you're going to have a decrease in aerobic energy production and an increase in anaerobic energy production, or anaerobic ATP resynthesis. What this means is if you've got less oxygen and more anaerobic ATP, you're going to suffer fatigue faster because you're going to accumulate those metabolic byproducts, specifically hydrogen ions. So if we're talking about fatigue with relation to a specific type of muscle contraction, it's worth having a bit of a look at this isometric contraction and the concept of fatigue due to a decrease in blood flow.